Ever wondered if you could wake up during surgery? Or if anesthesia could cause long-term memory issues? These questions and many more often raise concerns about anesthesia. Today, let's debunk some of these common misconceptions. First off, let's address the elephant in the room, the fear of waking up during surgery. This phenomenon is known as anesthesia awareness, and it's extremely rare. In fact, it occurs in fewer than 2 out of every 1,000 surgical cases. That's less than 1/4%. So rest assured that the chances of this happening are minuscule. Anesthesiologists, with their extensive training and experience, are there to ensure that you stay comfortable and unaware throughout the procedure. Another common misconception is that anesthesia can lead to long-term memory problems. While it's true that some people may experience temporary memory loss or confusion immediately after surgery, these effects are typically short-lived. There is no scientific evidence to suggest that anesthesia causes long-term memory problems. The brain is a complex organ, and many factors can influence memory, but anesthesia is not one of them. Some also believe that anesthesia can be fatal. Let's clarify this. Anesthesia-related deaths are extremely rare. Advances in medical technology, along with the expertise of anesthesiologists, have made anesthesia safer than ever. The risk of dying from anesthesia is estimated to be less than 1 in 200,000. That's far less than your chance of being struck by lightning. Lastly, there's a myth that all anesthesia is the same. This is far from the truth. There are different types of anesthesia, local, regional, and general, each used for different kinds of procedures and each with its own set of considerations. Anesthesia is not a one-size-fits-all solution. It's tailored to the individual patient's needs, considering factors like their overall health, the type of surgery, and even their personal preferences. Now that we've cleared up some misconceptions, let's dive into what you need to avoid before anesthesia. Before you go under the knife, there are some dietary restrictions you should be aware of. Anesthesia, while a powerful tool in pain management during procedures, requires certain precautions to ensure its effectiveness and your safety. First and foremost, it's crucial to refrain from eating or drinking for several hours before your procedure. Generally, this fasting period is about 8 hours, but your anesthesia specialist may advise a longer or shorter period depending on your specific situation. This includes not just meals, but also snacks, gum, and even water. You might be wondering why this is so important. Well, when you're under anesthesia, your body's reflexes are temporarily paused. This means that if your stomach contains food or liquid, there's a risk it could enter your lungs, a scenario known as aspiration, which can lead to serious complications such as pneumonia or other lung infections. Next up is alcohol. It's recommended to avoid alcohol for at least 24 hours before anesthesia. Alcohol can affect the way your body responds to anesthesia, and can also increase your risk of complications, including bleeding. Caffeine is another substance to steer clear of. It's best to avoid caffeine for at least 24 hours before your procedure, as it can increase your heart rate and blood pressure, potentially making anesthesia riskier. Even certain types of food should be avoided. Foods rich in vitamin K, such as leafy green vegetables, can interfere with some anesthesia medications. Similarly, foods high in fat can slow down the absorption of anesthetic drugs. Lastly, remember to discuss any dietary supplements, vitamins, or herbal remedies you're taking with your anesthesia specialist. Some of these can interact with anesthesia, potentially affecting its effectiveness or causing unwanted side effects. Remember, not following these dietary restrictions could lead to serious complications. Your safety is paramount, and these guidelines are in place to ensure your procedure goes as smoothly as possible. So, when it comes to preparing for anesthesia, it's not just about what you do, but also about what you don't do. Your cooperation is a vital part of the process, contributing to a successful outcome. Did you know that certain medications could interfere with anesthesia? That's right. There's a complex dance going on in your body when anesthesia is administered, and certain medications could step on the toes of your anesthesiologist's efforts. It's like a well-choreographed ballet where every performer has a specific role to play. Your anesthesiologist is the conductor, ensuring that everything goes smoothly. But if you introduce an unexpected dancer, like certain medications, it can disrupt the entire performance. This is why it's crucial to disclose all medications you're taking to your doctor before the procedure. It's not just prescription drugs we're talking about. Over-the-counter medications, supplements, and even herbal remedies can also have an impact. One key player in this dance are blood thinners, medications that prevent blood clots. They may sound harmless, but in the context of surgery, they can increase the risk of bleeding. If your doctor knows you're on blood thinners, they can adjust your anesthesia plan accordingly. Certain heart medications are another category to watch out for. These drugs can affect your heart rate and blood pressure, both of which are factors your anesthesiologist needs to control during the procedure. Other medications that can potentially interfere with anesthesia include drugs for asthma, diabetes, and even some types of antidepressants. The list goes on. Now, this doesn't mean you need to go off your medications before surgery. In fact, stopping some medications abruptly can be more harmful. The key is open communication with your doctor. They can guide you on how to manage your medications, which ones to continue, which ones to adjust, and which ones to pause. Remember, the goal is not to scare you, but to prepare you. Anesthesia is a powerful tool that has made countless procedures possible and significantly less painful. But like any powerful tool, it needs to be used wisely and with full knowledge of all the factors at play. So the next time you're preparing for a procedure, do your part in the dance. Always disclose your full medical history to your anesthesiologist to ensure a safe procedure. Your lifestyle choices could affect how anesthesia works in your body. Let's delve into the impact of lifestyle factors on anesthesia. The choices you make every day, such as whether to smoke, drink alcohol, or use recreational drugs, can have a profound effect on how anesthesia works during your surgery. Take smoking, for instance. Smoking reduces the amount of oxygen in your blood, a key component necessary for the body to heal and recover. If you're a smoker, anesthesia could take longer to leave your body after surgery, and your recovery period could be prolonged. Hence, it's advisable to quit smoking at least a few weeks before your surgery. Not only will this help anesthesia work more effectively, but it will also contribute to a quicker recovery. Similarly, alcohol can also interfere with anesthesia. Regular consumption of alcohol can alter your body's response to anesthesia, potentially leading to complications. It can increase the risk of bleeding, affect your heart and lung functions, and even influence how your body metabolizes the anesthetic drugs. Cutting back on alcohol, especially in the days leading up to your surgery, can help mitigate these risks. As for recreational drugs, they can have unpredictable interactions with anesthetic drugs. Whether it's marijuana, cocaine, or something else, these substances can affect your heart rate, blood pressure, and breathing, making it more challenging to safely administer anesthesia. If you're using any such substances, it's crucial to disclose this to your anesthesiologist. They need to know everything that might affect your body's response to anesthesia. So as you can see, your lifestyle choices play a significant role in how anesthesia works in your body. By making the right choices, you can ensure a smoother surgical experience and a faster recovery. Remember, the goal is not just to get through surgery, but to recover well and thrive afterwards. Your lifestyle choices can significantly impact the effectiveness of anesthesia and your recovery from surgery. Let's summarize what we've learned today about preparing for anesthesia. It's been an enlightening journey, hasn't it? We've busted some common myths, shed light on dietary guidelines, talked about medication interactions, and even touched on how your lifestyle choices can impact your anesthesia experience. Firstly, we debunked some misconceptions. Anesthesia is not a one-size-fits-all practice. There's a wide range of methods, and the best one for you depends on factors like your health, the type of surgery, and your surgeon's preference. Anesthesia does have risks, but they are minimal when administered by a trained specialist. And contrary to popular belief, you won't spill all your secrets while under. Then we moved on to diet. The golden rule is, nothing by mouth at midnight. That means no food, no water, not even a piece of gum. This is to prevent aspiration, a serious complication where stomach contents can end up in the lungs. That also includes avoiding alcohol and smoking, as they can complicate your recovery. Medication was our next topic. It's crucial to disclose all medications, supplements, or herbal remedies you're taking. Some can interact negatively with anesthesia, so it's always better to be transparent with your doctor. Even if you think it's not important, it could make all the difference. Lastly, we discussed lifestyle factors. Regular exercise, a balanced diet, and a good sleep schedule can improve your body's resilience to anesthesia and speed up recovery. If you smoke or drink excessively, now would be a good time to consider quitting or at least cutting back. To encapsulate, the more prepared you are, the better your experience with anesthesia will be. It's not just about the day of the surgery, but also about the days leading up to it. Every choice you make can influence your journey. Remember, your safety during surgery is paramount. Always follow your anesthesia specialist's advice to ensure a smooth procedure. It's a team effort, and you are a vital part of that team. Here's to safe and successful surgeries.